common thing that I have seen is that people think the symptoms is from something else. Denial is a common factor. Once they recognize that this could be heart, they do not attack it as quickly or with the system in place, they don't do it. So let's take a step back. Symptoms: chest pain, chest pressure, heaviness. Generally heart gives pressure and pain in the center of the chest. It's not left side, it's the center of the chest. It travels to the shoulder, it travels to the jaw. It feels like it's going down the arm. You may get numbness in the hand. You may get a lot of sweating, profuse sweating. When you have that, consider this could be heart. You may or may not have, but shortness of breath is another symptom. You may feel lightheaded or may feel like you're going to pass out. You may not have all of the symptoms. You may not have any of the symptoms and only have one symptom. In Southeast Asian population, I've seen commonly that after eating meal, when they eat dinner, after they feel like I have gas and they are burping, and then sometimes they say, when I burp, I feel better. These are common symptoms of heart attack. I have seen many patients staying home with these symptoms and thinking that it's something else, and then later on either finding out they have heart attack or later on I'm going to their funeral. So very important to recognize the symptoms. Number two, if you have these symptoms and if the intensity of the symptoms is high, then in America we have an excellent healthcare system in place where you do not want to try to drive yourself or have your spouse drive you to the emergency room. Call 911, let them come, and they are equipped to do whatever they need to do on site. Going a little bit into the treatment, if you are having a heart attack, when the EMS guys come in, they will give you baby aspirin. If you have baby aspirin at home, at least chew the baby aspirin, 2 of them, if you are having the symptoms. When they come in, they will do your EKG and they can alert the healthcare system that this patient is having a major heart attack. So by the time you come to the hospital, I might be at the hospital waiting for you to go into your heart artery through the wrist artery, and by using wires and balloons and stents, which are like little metal spring, we can go ahead and open up the 100% blocked artery. Time is the muscle. As quickly you reach to the hospital, as quickly the artery gets opened up, less likely or less amount of size of muscle damage happens. Lesser the muscle damage happens, lesser chances that you will suffer consequences or complications of heart attack. So you would less likely to suffer heart failure, irregular rhythm, less likely to require defibrillator and things like that, more likely to live longer. So very important, you recognize symptoms, you get the treatment attention promptly. If somebody has multiple blockage and requires more treatment, there are other treatment options such as open heart surgery, but very important to recognize these symptoms and act on it promptly.